friends, I am Dr. S. Mondal, BHMS Honours Consultant Homeopathic Physician. Today I want to discuss another very important rheumatological and systemic topic is lupus, systemic lupus erythematosus or lupus or SLE. This video is basically especially for my non-Bengali followers. SLE is a systemic disorder and it is an autoimmune process. What is autoimmune process? When the body's immune system attack the own body tissue and associated with some systemic illness like as some skin symptom, some kidney symptom, and blood cells, brain, heart and lungs may be affected. And it is a most important, the distinguishing sign and symptom of the lupus is the facial rash, like the wings of the butterfly and unfolding across both cheeks and occurs in many but not all cases present in case of lupus. After that, what are the causes of the lupus or SLE? It is an autoimmune disease or combination of the genetic and environmental factor, and after that it is the inherited predisposition for the lupus may appear. The people with inherited predisposition of the lupus may develop the disease. First one is the causes of lupus is sunlight or exposure to the sun and skin lesion may develop the SLE. Patient who have susceptibility for developing the SLE. And after that, the infection, having an infection and can initiate the lupus and cause relapse in some people. And after that, medication, and some medication like the medicine, various medicine, allopathic medicine used for treating the high blood pressure or hypertension, high blood pressure or seizure or epilepsy, and this medication and or various form of antibiotic, and the side effect of this type of medicine or develop the SLE. For some people, this condition is called drug induced lupus. In case of when they stop taking the medicine and when it is usually people who have drug induced usually get better when stop this type of medication. And what are the risk factor for SLE? There is your women are commonly affected, women are commonly affected than men, and age is basically developed the reproductive age group, especially 15 to 45 years of age. And race, lupus is more common in African American and Asian African population and Hispanic also. What are the symptom of the SLE is a very important point. No two cases of the lupus are exactly alike. No two cases of the lupus are not alike. Sign and symptom may come or suddenly or gradually, may be mild to severe or may be temporary or may be permanent. And after that, the aura of the systemic lupus erythematosus, that is called the flare, and associated symptom like the fatigue, fever, joint pain and stiffness, swelling, and very important, there is the butterfly shaped rash on the face, on cover the cheek and breeze the nose, rashes elsewhere of the body. After that, the skin lesion appear which owes in sun exposure, and fatty finger may be involved, and some chest symptom like the shortness of breath and chest pain, dry eyes may be developed, and some nervous system symptom related with nervous system, headache, dizziness and memory loss can be developed. What are the complication of the SLE or lupus? Kidney damage. The main complication of the lupus or SLE is the damage the kidney or kidney failure is a very important complication. Brain and nervous system. In case of lupus, the complication of the lupus can be developed or affect the central nervous system, and symptom or disease like the headache, dizziness, dementia, behavioral changes, seizure and cerebrovascular accident can be developed. blood and blood vessels. Blood and blood vessels, anemia may be developed, and various types of clotting problems can be developed. Lungs, and inflammation of the chest or lungs, and cavity formation and pneumonia can be developed, and heart. And after that, this is another very important complication. This is the weaken the heart muscle and harden the coronary vessels and develop the coronary artery disease, and increases the risk for developing the heart failure. And other types of complication, like as the infection, very vulnerable to infection, various type of like viral and bacterial, like influenza, pneumonia, and corona, etc. And cancer and bone tissue death. In case of lupus erythematosus, can risk for developing the bone cancer may be developed. And pregnancy complication, lupus can be increase the risk for miscarriage, increases the risk for miscarriage, and it increases the gestational hypertension, or increase the high blood pressure with epilepsy or seizure, and that this condition is called the eclampsia and preeclampsia may be developed. After that, what are the diagnostic procedure of the SLE? The lupus is diagnosis of the lupus is very difficult. Sign and symptom considerably, that's because the vary the sign and symptom person to person. The combination of the blood, urine test, sign and symptom, and physical examination can finding lead to the diagnosis of the SLE. What are the laboratory tests? In case of hematological test, the RBC and WBC, complete blood count. In complete blood count, the erythrocyte total RBC count, total WBC count, neutrophil, eosinophil, basophil, lymphocyte and monocyte also count, and platelet also. And erythrocyte sedimentation rate severely increases in cases of SLE. And the kidney and liver assessment. The byproduct of kidney is the urea and creatinine should be assessed, and to know the proper working or proper condition of the kidney, or proper status of the kidney, and liver also through diagnosis the liver function test. And after that, the urine analysis. Increase the protein level of the raw red blood cell in the urine. The examination of the sample of urine may show the increased level of protein or RBC cell in urine, and it is the which may occur if lupus has affected the kidney. And after that is a very important and confirmatory test is the anti-nuclear antibody or ANA test. A positive test for the presence of these antibodies. This is the autoimmune cell, indicates stimulated the immune system. This is a confirmatory test for diagnosis the SLE. And imaging test like chest X-ray should be performed. And echocardiogram, the sound wave and produce the real time image of the beating of hearts can be developed. And biopsy, lupus can harm your kidney and many different ways. That's why a small sample from the kidney should be tested and perform the biopsy. And skin biopsy confirm the diagnosis of the lupus affecting the skin. And preventive measures like the see your doctor regularly, first one, and remove the stress and perform the yoga or meditation and other the stress releasing technique, and regular exercise to avoid the sun exposure. During exposing the sunlight, and protect your protective clothing, wearing the protective clothes such as the hat and long sleeved shirt and long pants, etc. Get regular exercise and stop smoking, and eat a healthy diet. In case of high blood pressure, kidney damage, or various type of gastrointestinal problem, red meat should be avoided, mutton, beef should be avoided, and green vegetables and seasonal fruits should be taken. And sometimes the vitamin D supplement can be need according to the situation of the patient, or depending on your age, dose should be selected. Today's topic is that's why the SLE should be preventable. Thank you.